trying not to panic folks. We're trying not to be panicked ourselves, but we're trying to be really clear that this is a crisis. If we continue on in the fashion that we have, then we won't be able to meet our payroll and we won't be able to cover our costs, and we'll have to close our doors.
This is our negative pressure room where we would treat anybody that has any infectious disease. If I open the door, you can see it breaks suction. When the door closes again, the negative pressure is inside the room. All the air is contained in there.
There's going to be a wave of patients coming to every hospital that goes above and beyond what they normally see in terms of patient volume. And so we're preparing for that. We are gearing up for that. And that is a costly endeavor in and of itself. Having no patients because of the social distancing, we now have even less funds to deal with. And when you have no revenue coming in, it affects your cash on hand, which is really the way that we judge whether we have money to pay for payroll and pay our bills. Three Rivers Hospital is a public hospital. We have the largest geographic public hospital district in the state and one of the largest in the country. It's about 2,500 square miles. Total lives, or total folks that live in our hospital district are about 15,000. We're sort of the first responders, and then if more is needed beyond what we can provide, then patients are transferred to the places where they can get the type of care that they actually need. The way that hospitals are reimbursed or compensated for the care that they provide is through the number of patients that they see. The fewer patients you see, the less revenue you have, and the more patients you see, the higher revenue you have. We were able to provide enough care to cover the costs of doing that care, but with the social distancing that's taken place and with the governor's order on stopping elective surgeries, in effect it's shut off the valve to patient care and our revenue. So we simply just don't have any revenue at this point. It has put our hospital at risk in a time when we may be needed more than we've ever been needed in the history of modern hospitals. What we really need at this time is financial assistance during this patient lull that we're in. Right now, we have about 3 to 4 weeks of cash on hand. That means we have approximately 2 payrolls that we can meet, and that's probably about the time the surge is going to start to hit.
We're preparing for it. We're thinking about it for sure. You know, we want to be ready. We want to be able to protect ourselves and care for our community. So, you know, we're hoping we don't get there, but we want to be ready for it. Yeah.
It would be a terrible time to lose hospitals in rural communities when we're facing this coronavirus pandemic. If you look at what's happened since 2010, over 120 critical access and rural hospitals have closed. And that was before the pandemic. And with the pandemic, you're looking at and accelerating that closure rate at a time when we can ill afford for that to happen. You think about what keeps me awake at night right now, it's our staff safety and it's our financial survivability through this.